First off, I made sure I am wearing a lab gown and a pair of surgical gloves before doing anything with the pig's heart. Now, I'm gonna begin with placing the pig's heart on this pan with paper towels. Based on my observation from the anterior view of the heart, there is the anterior interventricular sulcus. And within the sulcus, I can observe the anterior coronary blood vessels. As for the observable holes or blood vessels of the heart, here is the vena cava leading to the right atrium, the brachiocephalic, the carotid, and subclavian artery from the aortic arc originating from the left ventricle, the pulmonary arteries coming from the pulmonary trunk from the right ventricle, then lastly, the pulmonary vein leading to the left atrium. Next, I found 4 chambers, and they are the right atrium, the right ventricle, and left atrium, and the left ventricle. Now that I have determined the external parts of the pig's heart, it is time to dissect it by making a cut around the perimeter, from the vena cava to the pulmonary vein. Beginning from the vena cava, the oxygenated blood enters into the right atrium. We then have the tricuspid valve, which has its chordae tendineae attached to 3 papillary muscles within the right ventricle. The right ventricle, as well as the left, contains some grooves called the trabeculae carneae. From this right ventricle here, blood will enter into this pulmonary valve, which will enter the pulmonary trunk to the pulmonary artery into the lungs to be oxygenated. After the blood is oxygenated, blood enters into the pulmonary vein into this left atrium here. Then, it will go through the mitral or bicuspid valve with its own chordae tendineae attached to the 2 papillary muscles within the left ventricle. From that, blood will go into the left ventricle here, which has a thicker muscle or myocardium than the right. Blood will then enter into the aortic valve, straight into the aortic arc to all the arteries providing blood to the rest of the body. Lastly, we have the interventricular septum, which divide the right and left ventricles. And for the different layers of the heart wall, the epicardium on the outer side, the myocardium in the middle, and the endocardium in the inside. And that is all the observable parts of the pig's heart. Thank you.